This pandemic has many people thinking about what happens to their family when they're no longer here, especially for breadwinners and heads of household. How do you plan for your family's future if you could barely make ends meet? Let's now have an exchange with microinsurance experts Roy Miclat and Salve Antiquera. Thank you so much for joining us on the program. Roy, let's start off with you. During this challenging COVID-19 health crisis, is your company committed to micro-insure our kababayans?
Yeah, Rico. We are very committed in insuring our kababayans, especially those member of cooperatives. In fact, we added more benefits for coverage for COVID-19 pandemic, and we have paid about 4 million pesos in this period of pandemic for victims of COVID-19.
So, Roy, what additional requirements and benefits did you add?
Well, we have added right now for 50 pesos, you are covered if you are positive for COVID-19 through the RT-PCR test. We will give you 2,500 for when you are confined for 14 days recovery period. So 2,500 if you're asymptomatic. But if you get confined, we will reimburse 10,000 pesos of your expense plus 2,500 pesos of your confinement. So that's how we support our kababayan, especially member of cooperatives.
Salve, ano ba mga requirements para makakuha ng microinsurance ang ating mga kababayan?
Simple lang ang mga requirements namin. Meron lang silang dapat 18 to 65, 60 years old upon enrollment. Meron lang silang birth certificate, marriage contract, na mapapatunay na sila nga ay nasa tamang edad, at saka kung sila ay may asawa, kasi ang amin pong produkto ay hindi lang pang miyembro, kundi kasama ang 7 miyembro ng pamilya. So 5 anak, asawa at sinanay.
So, Salve, kung mag-a-apply sila ngayon, kailan nila pwedeng ma-insure ang kanilang sarili at ang kanilang pamilya? Ilang araw?
After 24 hours, yun ang effectivity ng kanilang insurance.
So, Roy, Salve, pakinggan natin ngayon ang report ni Lois Calderon on the Acero family who want to get insured pero wala silang pera.
Napakasakit po.
Tragedy hit Jennifer Acero when she tested positive for COVID-19. A single mother and the family's breadwinner, Acero worried more about how her 5 children and their own kids will survive without her. Getting sick means sinking in debt. Dying means unplugging her children's lifeline.
Ay, iniisip ko po yung mga pamilya ko nung nandun po ako, kung paano na po sila, ano po bang kakainin nila.
Acero spent 14 days in an isolation facility built by her local government. A first-class city, Calamba has budget to contain the outbreak, from testing to medicines. But the quarantine facility handles mild COVID-19 cases only. Private hospital bills would cost somewhere from 300,000 pesos to millions of pesos.
Kung ito ay cases na hindi ma-handle or ma-manage doon sa monitoring facility at kailangan silang ilipat sa hospital.
With public health service within reach in Calamba, Acero survived COVID-19. But looking back, she wished she had savings or insurance as protection for her family in crisis like this. The money she makes from manicure services brings food to the table and pays the bills.
Tingin ko baka 50 po, pwede na po yun, ma'am, per day sa mga katulad namin.
The thing about the business of insurance is that the older the insured, the higher the premium. 50 pesos or $1 per day is all that low-income workers like Acero can afford to get covered. Lois Calderon, CNN Philippines.
So, Roy, Jennifer and her family are really going through tough times. And also many of our kababayans going through this COVID-19 pandemic. 50 pesos a day is all that the Acero family can afford. So you mentioned they can be helped. They can be micro-insured.
Yes, mahal na yung 50 pesos per day.
Oo.
Kasi yung 50 pesos namin na ang benefit ay yung naging positive ka for 14 days na recovery period mo, yung 50 pesos namin pang isang taon na yon, hindi pang isang araw.
Kung
But if
meron
you-
lang silang 5 piso o 10 piso, pwede na rin ba yan?
Pwede na rin yan. Ang gagawin nila, maghuhulog sila unti-unti hanggang mabuo nila yung 50 pesos. No? Pero kung gusto nilang mas mataas na coverage, halimbawa 120 pesos isang taon, meron silang 300 pesos per day naman pag na-confine sila sa COVID for 14 days. So that's how cheap microinsurance is. Because we go for numbers, Rico. Kasi mas maraming kababayan natin ang nai-insure natin, mas nagiging mura yung premium. Kami ni Salve, magkasama kami niyan sa microinsurance. No? Magkapatid kami kasi mutual. Ibig sabihin, ang gumagamit ng negosyo ng business o ng produkto ay siya ring may-ari ng ating mga institusyon na to, no? Cooperative or MDA, micro-MDA. So, mas maganda ang epekto nito kaysa sa mag-i-insure ka sa private. I mean, I don't have anything against private, but bumabalik kasi yung ibinabayad mo sa pamamagitan ng patronage refund or other services.
So, Salve, for example, no, isang individual o isang pamilya, nagbayad na sila ng kanilang mga insurance premiums for the past 2 years. But itong COVID at saka yung lockdowns, nawala yung trabaho nila, hindi nila mababayaran yung kanilang mga daily or monthly insurance premiums. Pwede ba nilang kunin yung pera ulit para makabuhay?
Yes. Sa aming basic life insurance plan, meron kaming kasama sa produkto iyon na kapag mag-resign sila o for certain reasons, ay pwede nilang kuhanin na yung kanilang pera. Kasi 50% ng binayad nila na premium, which is 15 pesos a week na insurance premium, ay kalahati dyan ay naka-reserve yan para sa kanila. Kaya kung sila ay aalis, sila ay kung anumang mangyari at gusto nilang kuhanin yung pera nila, 50% of that will be returned to them.
That is good news. Maraming salamat po sa inyong assuring exchange, Roy Miclat and Salve Antiquera, microinsurance experts.